Hi, I'm Dr. Deanne Collier. I'm a board-certified dermatologist and dermatologic surgeon, and I practice in Jupiter, Florida. I am also a member of the Leroy Jefferson Medical Society. The Leroy Jefferson Medical Society is a society of healthcare providers, including doctors and other providers like nurses, pharmacists, chiropractors, that provide health services to patients in the community, including education, health information, and screening services for patients with limited access. My contribution to Leroy Jefferson has been mainly providing health lectures to patients and people in the community about skin, the importance of skin care, awareness of skin diseases like hair loss, acne, skin cancer prevention, and that's what I've lectured on to patients in the community. I was born in Mount Vernon, New York, and I moved to Florida when I was 6 years old. My parents are both from Jamaica, and we had a lot of family in South Florida, so we moved when I was 6 years old, and I was raised in the West Palm Beach, Florida area. I went to college at Georgetown University. I went to medical school at Emory University in Atlanta, Georgia, and I went to Cornell University Medical College, New York Hospital in Manhattan. So I went back to New York for my dermatologic training, and I stayed in New York and worked in private practice for many years after I finished my training. We decided to relocate back to South Florida once we had a baby, and we wanted to be closer to family, and I wanted to open up my own practice, which is currently set up in Jupiter, Florida. I have a husband. We've been married for 13 years, and we have a 6-year-old son. He is involved in t-ball, taekwondo, and a lot of activities at school. He is in kindergarten, so my time away from my practice is really spent doing things with him and his social calendar. We travel a lot during the summers when he's off from school, and reading is also a hobby I have when I'm able to find some free time outside of the practice of medicine. A dermatologist is a physician that specializes in the treatment of hair, skin, and nails. So my day is spent taking care of patients with complaints involving those areas. I am in my own private practice, and so for me, my typical day is 8 to 5. I have patients booked, and they come in complaining of a variety of complaints, everything from acne, warts, rashes on their skin. A lot of my time is spent conducting skin cancer screenings, examining patients' skin to remove suspicious growths or things that have been bleeding to make sure they don't have skin cancer. What a lot of people may not know is that Bob Marley, the famous reggae singer, passed away from a melanoma, which is a deadly skin cancer. It started under his toenail and spread inside his body. And so that's what I do during the bulk of my day, is examining patients' skin to make sure they don't have skin cancer. But I also take care of kids with rashes and acne and warts and fungus. I take care of adults who complain about uneven complexion, hair loss, wrinkles. A lot of my day is spent doing cosmetic procedures, including Botox and Restylane. So the job of a dermatologist is very varied. I spend a lot of time doing surgery, removing growths that patients don't like, that may not be cancerous, but they just don't like them on their skin. I talk to patients about their scars and how to improve their appearance. And my job is very gratifying. I wouldn't trade it for the world. I've had patients come up to me and hug me and tell me I've changed their life. They used to have low self-esteem because of their skin complexion and their acne and their hair loss, and I've help them treat those conditions, and now they can walk out confidently. And I really take pride in my work and what I do. The reason I got interested in dermatology was because as a child I suffered with eczema and acne, and I was constantly going to the dermatologist for treatment. And I just realized how important that could affect someone's life, because the first thing you see when you see someone is their skin. And if someone has a skin disorder, it can really affect their life. I think it's really important for students to consider a career in medicine, because medicine offers a lot of variety. If you're the type of person that wants to do research, you could work at a research center, at a medical center where you train doctors and come up with innovative therapies that may lead to products that are sold at the cosmetic center. Or you can work in private practice like I do and see patients in the private practice arena in your office. Or you can decide to pursue another specialty and work primarily in the hospital, taking care of patients in the emergency room or performing surgery. So medicine offers a lot of variety. There's a lot of innovations and advances. You're constantly learning, and I think it's a very dynamic field to consider.